I'm Dr. Gayatri. I belong to the 18 batch of Madras Medical College. I scored rank 568 in NEET PG 2024. I'm going to talk to you about how to make the right choice in NEET PG counselling. Which branch is best for me? Will I get the branch of my choice? And you are passionate towards medicine. But some seniors or guides are suggesting you to take radio or derm. What are the difficulties faced in this particular career? Yet all the factors that you should consider before choosing a branch. See, this college or hospital is going to mark the beginning of your career as a specialist. So consider all these aspects before choosing a college. And if you need some clarity, you can use a scoring system like this. I finally am now doing in complete contrast to what my aim was initially. Hi everyone. Congratulations. If you've cleared NEET PG and you're appearing for NEET PG counselling, then this video is for you. We know that this is a very confusing period. All our friends, family members and peers will have opinions about how our career should be, and we ourselves are in a bit of a dilemma. Which branch is best for me? Will I get the branch of my choice? Which college should I apply for? Should I take an all India quota or state quota? So which is best for your career? So this video is going to help you in the decision making process of your PG counselling. Without further delay, let's get on with it. Step 1 is open-minded analysis. Obviously in this period you'll have a million thoughts and fears. Just don't let the dilemma frighten you. Be open to all the choices that are available to you. For example, you've got a great rank and you are passionate towards medicine, but some seniors or guides are suggesting you to take radio or derm because these are the most sought after branches currently. Then just consider them, consider their pros and cons and why they will or won't work for you, and then reject them. What I'm saying is make sure that your final decision is based on informed, calculated thought process, not just by blind emotion. Now you might fall into one of these three categories. First is you're really passionate about a particular branch. You've got a great rank and now you're eligible for that seat. Good job. Now just reconfirm your decision from a neutral perspective, because it sometimes happens that we're blindsided by our love for a subject or our experience in internship that we fail to consider how our daily life will be in that particular career line. So talk to postgraduates, talk to practicing clinicians about how their daily life is, how is the job satisfaction, what are the difficulties faced in this particular career. If you were really passionate about this branch, then these is not going to deter you anyway. It's just about knowing how your future down the line looks like. Second category is you were not really inclined towards one particular subject before giving the exam and now you're in a dilemma. And category number 3 is you doesn't look like you're going to get the branch of your choice, so you're considering your backup options. So in the second and third scenario, this video is going to highlight all the factors that you should consider before choosing a branch. Finally, it all comes down to this: you should make the best available decision for your choices. Moving on to step 2, make a primitive list of all the available choices, both according to your colleges and branches. Download the PDF of choice blocking of last year's All India quota and state quota and analyze it as to where you stand based on your rank, what all are available to you. I had used Zynerd to filter out the colleges based on your rank, community, All India quota and state quota separately. So this will give you a somewhat average idea as to what are all the choices open. Now prioritizing this list will be what you should work on. Moving on to the next step, choosing a branch. This is very important. You cannot work all your life in a branch that you don't even like. So consider all these things before choosing. Obviously starting with passion and job satisfaction. Moving on to post-graduation life as to how was it chill or is it really hard, and then your career. Obviously starting with lifestyle, salary, how is your daily working life. Do you need a lot of physical efforts? Will you be doing procedures or surgeries and standing for long hours, or will you be handling OPD basis? Next is initial setup requirements. Obviously some branches like radio and derm will need initial investments because the equipments are expensive and so on. Next is interdependence between branches. For example, like anesthesia will be dependent on surgical branches, so that is there. And next is on-call duties. There are some branches where you will need to be on call, like anesthesia and OG. Is there a super specialty requirement, and are you ready to spend 3 more years for it? Next, how is the demand? How are the job opportunities in the city of your choice? Finally, does it all align with what you had dreamed of for your life as a doctor? Because that's what matters most anyway. Now you're so close to bringing your dreams to reality. Next step, choosing your college. Now that you've narrowed down on your branches, now how to choose your college. See, this college or hospital is going to mark the beginning of your career as a specialist. So you should learn all the key aspects. You should have good or enough clinical exposure so that you have the confidence to practice by yourself at the end of 3 years. But you should also see that you don't lose yourself or your passion in this process. So consider all of these aspects before choosing a college. Let's start with clinical experience in learning. First is how many inpatients are there, how many outpatients are there, is there an ICU setup, how many beds are there in the ICU, and during the clinical rounds, like do the consultants give a lot of inputs, how is their knowledge, is there super speciality in your hospital, and how is the SS exposure for PGs, how many procedures do you get to do, like central line, intubation, and so on, and how is the hands-on experience is especially important for surgical branches. Moving on to working hours, how is your daily routine? How many 24-hour duties do you have? Do you have night duties? And how is your post duty look? Do you have post duty off? Do you have Sunday offs? And how frequent are they? And how do all of these number of duties vary from first year to third year? How frequently do you have classes? How is the final exam pass rates? How is the stipend in this college? Is there a bond implemented? If so, what is the value of the bond? For how many years is it implemented? Ask about the toxicity, like has anybody quit, what are the quit rates, and do you get leave granted. These were the basics, but if you've really narrowed down to 1 to 5 colleges, then you should ask these as well, like how does the life in ward look for a first year, second year, and third year PG. If there are night duties, do you have a doctor's room, do you have security, have there been instances of violence between patient attenders and doctors. Next, if you're thinking of a college in a different city, you should consider the language barriers, cultural differences, safety, if home visits are possible and how frequently, is there a hostel on campus, how is the access and food, if there's a discrimination or in hands-on for people from different states. Next, you should ask about the hospital infrastructure, like are all basic labs done there? How are the radiological investigations? Is there referral from your particular college? Finally, you should also ask, that is there. Do you think there's any drawback in this particular college, like what this particular aspect is lacking, or this needs more exposure, and so on. Next is the groundwork. Obviously, I have told you a lot of aspects to consider, and you'll be thinking how I'll get so much information. It's basically by talking to contacts. You should get one contact from that college and then ask 5 more PG's numbers and so on. You should speak to as many people as possible. Like you should speak to first year, second year, and third year. See, first year is basically overworked in most of the colleges, and so obviously they might not give you a very unbiased review of the college, but you should get their opinion since most of the ward work is done by them, and the physical challenges are maximum in first year. And second year you should ask about academics, clinical exposure, how is the thesis work, and so on. In third year also you have to ask them if they're confident in dealing with all the cases, or are there any lacunae in clinical exposure in that particular college, or this particular thing is lagging, and so on. If you've narrowed down to 3 options and your heart still does not know how to choose, and if you need some clarity, you can use a scoring system like this. It's just simple, out of 10, and you will give a score, and just use it to compare between the 3 options. For example, this is how my options looked before counseling. So here's a quick overview of my counseling confusion. I did my UG from MMC, and I had only 45 days for my NEET PG preparation. So in that period, my aim had always been MMC. And as far as the branch is concerned, since I loved my OG posting in internship, so I had thought I would take MMC OG. And once my rank came, I could get medicine radioderma as well. And now I did the groundwork, and I spoke to a couple of practicing OGians. So and then I realized that the work-life balance in OG was not actually my cup of tea. Obviously, it's a great branch. If you're passionate towards it, you should go for it. But it was just not suited to my personal needs. So now I was in confusion as to what to take, and I really wanted a clinical branch. So I had to choose between medicine, derm, radio, and peds. And radio and derm I ruled out pretty quickly because it was not what I had imagined for for my life as a doctor. So between medicine and peds, I finally am now doing pediatrics in Delhi, in complete contrast to what my aim was initially. So this is just to say how things can change during the thinking process before counseling. So that's it. Read all the steps of counseling carefully. There are a lot of YouTube videos on how you have to handle choice filling, choice locking, and so on. Keep yourselves updated. In the meantime, get all your documents in order. Apply for nativity certificate. Update your certificates if any. Make sure you're ready with the choices on the previous day to avoid last-minute confusions on the day of choice locking. All the best. Wish you get your dream branch in college. Hope you found this video useful. If you did, don't forget to like and share with your friends. If you're planning to give the next PG entrance exam, don't forget to check out my video on how I could crack NEET PG in just 45 days of preparation. Any other video suggestions that you have, like regarding NEET PG counseling, or how's my residency going, or how I was preparing, let me know in the comments. Thank you.